minute I rotated at JPS and I walked through the halls here and took care of patients and worked with the uppers that were on at the time, I just knew this was the place that was going to train me to be the emergency medicine doctor that I wanted to be.
Our program does a great job of teaching how to handle a level 1 trauma emergency department. It is very high volume, it is very high acuity.
I see there's like no better place to get more hands-on training than somewhere like JPS. From like day 1 of residency, like you're valued as a member of the team and they expect you just to get out there and start getting your feet wet.
The type of training we receive is so top-notch that I know whenever I get out into my attending hood, whatever comes my way, I know I'm going to be able to face that because I've either seen it, talked about it, or learned about it, or have actually done it.
We have a monthly simulation lab where we go in and we do high fidelity sim. We take pig tracheas or we take state-of-the-art mannequins. We have some neat stuff that we really get to do, and that's due to the ingenuity of our staff and the things that they're able to put together. And so, you know, we don't end up doing anything that we haven't run through, whether up here or here, many, many times before we, ultimately end up doing it.
The variety in patient acuity, the variety in procedures, you could easily find a resident doing a laceration repair or intubating someone. All these things encompass emergency medicine.
I think the important thing that we try to do is have a good work-life balance, and so we do incorporate a lot of fun opportunities for our residents to still be learning about ways to be a better ER doctor, but also kind of out of the ER setting. And so we do things like go to the Fort Worth Zoo to have a tox review on snake bites and spider bites. We go to the Botanic Gardens to learn about poisonous plants, and it just brings a bit of camaraderie and fun to the education.
There's a ton of leadership opportunities, there's a lot of committees that you can be a part of, and there's a lot of opportunity to just start things if you feel like the community is in need.
Mentorship is really, really important to us. So even when it comes to rotating medical students, we make sure that they have faculty and residents that are kind of assigned to them to be their guide and to help them out. And then once you become a resident, you also have an upper level resident that's assigned to you, as well as a faculty mentor. So from the very beginning, they feel like they're included, they're part of a family.
The transformation is amazing. They come in as interns and they become great physicians. And so to have them become teachers and leaders in their own right and then stay and help us on our mission is really an amazing sight.
Every time you talk about people loving where they work, it's always the people. It's always the people that really make you excited to come back every day.
Those relationships translate to being on the floor because when I look at the right side of the bed and I need a chest tube put in, I know my co-resident's gonna be right there. And when I have a question or I'm not sure what to do, if I look behind me, I know my attending is standing right there with the answer ready to go.
It's a complete blast. You're thrown right in with so much support and care, but really high expectations. That to me has been the best mixture of education because I've been able to push myself, but feel safe while doing so. And I've been able to grow so much over the last year and a half.
You seek the support of your co-interns and your uppers who are always going to be there for you, and knowing that they're going to have your back and ensure that if you need someone to help you, they're going to be there.
There are times where I have some of my colleagues that are coming over from other areas in the ED just to come help out when they see that we're busy in other areas. I feel like that sense of leadership and ownership that we have over our patients in our department is very strong.
We really all have the same mission, vision, values, not only for our emergency department, just for this hospital and for Tarrant County. And so I think when you feel that amongst your colleagues, it really does help you feel like you're in a special place, a home, a family.
The attitude is really what sets it apart more than anything. What's cool is this concept and this attitude of we're going to do whatever it takes to get it done. We're going to meet the mission. I mean, that's emergency medicine mindset in general, but being somewhere that is a county safety net, that's what's such a privilege about this place. Is just that we know that this is it for a lot of people. This is their access to care, and we're proud to provide that.
I know without a doubt that JPS has prepared me well for that next step, and I think that just the education here, the patients that we see, the acuity, the procedures, the competency that I feel coming out of this, I don't know that I would have if I went anywhere